If there's a silver lining to this story, it might start at Bradley Children's Hospital in Rhode Island.
We had every single bed in this hospital filled.
So many children needed treatment in 2014 that 503 were boarded. Dr. Henry Sachs is Bradley Hospital's medical director.
If the child's not getting treatment, the families are often very frustrated. They see their child sitting there for hours or days waiting for what they really need. And what we really need is much more robust outpatient care so that these children and family can get services much earlier in the process prior to their being in crisis.
Instead of adding beds, Sachs and his team decided to create a safety net of outpatient services lacking throughout the state. It included partial hospitalization programs for children who needed to be admitted but weren't sick enough to require an overnight stay.
They can be in their own bed at night with their family, but they're getting the treatment that they need during the day. So that's being seen by a psychiatrist every day, an individual therapist, there's group therapy.
They also expanded after-school outpatient programs and launched a crisis line to route children to the best level of care.
Good, I'm glad we can help with that.
By triaging kids to the right locations, they actually are being considered for lower levels of care. And so we're effectively not only keeping them from presenting to the ER, but we're also getting them into services.
And after all the programs were in place, the number of children waiting for care began to dramatically fall. 1 year after 503 children were boarded, the number was cut to 257, and even fewer have boarded this year. Does part of you want to say that you figured this out?
I think it's fair to say that we've improved the situation. I think we haven't figured it out, though.
If you're hoping Bradley can be a model for other hospitals, Dr. Sachs says it's not that simple. His facility treats only children with behavioral health problems, and most other hospitals just don't have that luxury.
We have a hospital administration that has competing interests. The cardiologist, the neurologist, the neurosurgeon, the oncologist, they all want a need growth in their services too, and so you have to balance your group of services you provide that reimburse better, and child psychiatry is not one of those.